everybody, Stacy here from Complete Wellness, and today I have a very, very special guest. This is Dr. George Zio, and it is Mental Health Awareness Month, and I've brought him in to clarify a few things for us, hopefully give us some insights on what's going on in the mental health world. So please tell us a little bit about you.
I'm a clinical psychologist, licensed in Pennsylvania and New Jersey. I have an office in Quakertown. Do telehealth, in-person sessions. I work a lot with couples. I do individual therapy as well. I guess that's about it. I've been doing this for almost 30 years.
Wow, you have a lot of experience.
Yeah, I've been doing it a day or two.
A day or two. So is there a specific, I say, field that you work within?
If you're talking about like mode of therapy that I do?
Sure, yeah. Mm-hmm.
Well, I was trained psychodynamically, which really comes out of the work of Freud in the last century or so. But I also do a lot of cognitive behavioral stuff, solution-focused,
Okay.
reality therapy. There's so many different models, and I think that they all build on each other.
Right.
So
because not everybody fits in that same box, right?
Right. I don't like boxes.
No.
So we're all individuals. So I think whatever is appropriate in the session is what's appropriate in the session, and that's what I try to do.
I like that. I like having a broad scope, not forcing people.
I think that most of the research shows that across all modalities, the one factor that is most important, well, let's say very important, is the therapeutic relationship, the relationship between the therapist and the client. And
Yes.
that's true whether you're psychodynamic or cognitive behavioral or solution focused, whatever it is. That seems to be a key component across all modalities.
I could see that. I mean, we do that with our own personal physician, right? We want someone who we click with, right? We also want someone who's going to give it to us straight, right? We don't want them to just feed whatever we're going through. We want them to help us work through it. So it's finding that right dynamic, right?
Mm-hmm.
Again, same with our physician, same with our friends, same with, everything in our life. We want to find that counselor or therapist or our person that's going to help us, and we click and they're hearing us.
Yeah, well, you need a therapist, number one, that you feel comfortable with. And number two, who is not going to pull punches, but not going to pull punches in a gentle way.
That's right.
So.
That's right.
Yeah.
Compassionate at the same time.
Compassionate, empathetic.
That's right.
Absolutely, that's critical.
That's right. I love that. So I have a couple questions here, just a few, like 25 or so. No, I'm just teasing. Now that you're on the hot spot.
Short list.
The short list. All the questions nobody's willing to ask, but I am. One of them is, what is the difference between a counselor, a psychologist, and a psychiatrist?
Well, a psychiatrist prescribes medication. They're generally an MD or a DO who has special training in psychiatric disorders.
Okay.
And primarily, they prescribe medication. A counselor could be a number of things. Mainly, counselors are people who are a licensed counselor, has a master's degree at least.
Okay.
And it can be in family therapy, it can be just as a licensed therapist, but they generally have a master's degree. Psychologists have a doctorate degree. We spend 400 million years in training.
And dollars.
And dollars. And sometimes before we die, we pay off that debt. But I think psychologists do not prescribe medication. Not yet. There's legislation in Harrisburg that is aimed at permitting psychologists to prescribe medication once they get some advanced training.
Right.
And that basically has come about because it's very difficult to find a psychiatrist.
Right.
They're few and far between these days, and they're really booked. Some people are waiting 9 months to get an appointment. So there's a movement to have psychologists who, frankly, we have a deep reservoir of training. It was many years ago, but I had courses in psychopharmacology and physiology and biology. So all of those things that physicians have, maybe not in the same detail that an MD or
Right.
a DO has, but we do have background. So it makes sense. And in the military, actually, psychologists are permitted to prescribe medication. So it's just, I guess it's just a movement of a pen in Harrisburg.
Right.
Before long, psychologists will prescribe medication as well. But that's the primary difference between a psychologist and a psychiatrist is, number one has an MD or a medical degree. The other has a doctoral degree in psychology. One prescribes medication. One at this point in Pennsylvania does not. Psychologists do not in Pennsylvania. And counselors generally have a master's degree, and there's some very highly skilled counselors.
Okay.
But that's kind of the difference, is the education and experience.
Okay. Wow. See, and I kept using psychologist and counselor interchangeably, and I'm in the wrong. So.
Well, it's one of the roles that psychologists have, right? As a psychologist, we give counsel.
True, but it really doesn't go the other way. I'm giving too much credit then the other way. Yeah. That's okay. I have been corrected. Okay, so the buzzwords are behavioral health, right? So behavioral health, is there a difference between behavioral health and mental health? Like, are they just interchangeable, like I've been using them, or am I wrong again?
Well, I don't think you're wrong. There's a wide umbrella under which things like behavioral health fall. Mental health, I like to use emotional health, because mental health is about our cognitions, right? The way that we feel about things, the way that we perceive things,
Okay.
the way that we understand the world around us. How we deal with stress and anxiety, and it's all behavioral, right? But it's also very much emotional and I guess mental health. It's all.
Okay.
Whereas behavioral health, to me, more is much broader, and it deals with things like dealing with, and some psychologists do this as well, work with children with different learning disabilities and behavioral issues. Some psychologists work with that as well. I don't.
Okay.
So when we say behavioral health, we're under the heading of behavioral health, but I look at it more as emotional, relational stuff for what I do.
Okay. So would behavioral health be more along the lines of more of a physical thing, like maybe OCD, or, I mean, I guess that's still
but
mental.
it's still mental.
You're
So
still
it's
caught
all-
up in it, but you're trying to change a behavior.
Yeah, and I think that's what we do anyway in mental health. I'm sure there's a much more succinct distinction.
Right.
And since I'm not very succinct very often, I can't really break down a
Yeah.
distinction. I believe there probably is one. But
Not trying to put you on the hot seat.
no. I just know that with, for example, when you're working with insurance companies, many insurance companies will have you under the caption of behavioral health,
Right.
because we do deal with different behaviors, and some will be under mental health and substance abuse.
Okay.
And substance abuse is a behavior as well. So
Okay.
I don't know. Since we're editing, I think we can.
We'll stir that through
We'll
again.
stir that
Do you want to
through.
try again and just be more succinct? I can ask it again.
Well, let's come back to it.
Okay, fair enough. All right, so let's see. So, what would we consider standard treatment? Like, if I were to come into a session, what might something I would expect? How would that look?
Well, first of all, I would hope that the psychologist would, or counselor would welcome you and let you know what the limits of confidentiality are, first
Okay.
of all, and go over that. And basically the limits of confidentiality are that anything that you say in a session is confidential, cannot be shared with anybody outside of the room, with some exception. And the exception is that if you were suicidal,
Okay.
we can't let you kill yourself.
Fair enough.
If you were homicidal, we definitely can't let you kill anybody else either. We're legally bound to
Fair enough.
break confidentiality there. And if you were to reveal that you're abusing a child, an elderly person, someone who cannot take care of themselves, we're required by law to report that
Okay.
as well. But other than that, anything that you say in a session is completely confidential, and I would hope that that's what the therapist would explain from the get-go.
Okay.
And then there's some assessment. Why are you here? To get some of that data, what's going on in your life, so we get a bunch of background
Okay.
from you that may be impacting whatever experience that you're having that brings you into therapy. And then we talk about solutions. A lot of what happens in therapy happens outside of the room. Putting into practice the things that we talk about in the session, thinking about the things that we talk about in the session, so that when you come back for the next session, we can kind of assess how those suggestions went and what your thought process was, and if anything changed.
Okay. So homework.
Homework, yeah. I generally, people sometimes ask for homework. I generally don't give homework. I think that homework is kind of implied in therapy. It's you're not going to come into a therapist's office and he may have a magic wand. I have one on my desk. It's not very powerful. But we can't, we're not going to come in and fix all the problems in one day. In fact, all we can do is offer suggestions, give some insights, help the client gain some insight,
Right.
and try to affect some type of behavioral change, which might, change the situation. Generally does.
I'm dating myself, but it's not like you're Jiminy Cricket and you're going to follow us around all the time and remind us that what we talked about, that's up to us. We have to take that with us and do with it what we will.
Yes, Jiminy Cricket.
Yeah.
I like Jiminy Cricket. The idea of let your conscience be your guide is not always a good idea because not everybody's conscience is
Where it needs to be.
where it needs to be. Yeah.
Yeah, I understand.
But I mean, I think that when people come to therapy, they're coming because they're struggling with something and they want some resolution. And I think our task is, as psychologists, is to work with the client, to work through what's going on and see what any precipitating factors are. And, if there's something going on with their thinking,
Right.
if they're from a cognitive behavioral perspective, if there's some, cognitive distortions, disordered thinking, catastrophizing, whatever it is, poor self-concept, to find out what's really going on so that we can make some suggestions to help the client to feel better about themselves and their environment and their capabilities. But a lot of that work happens by applying the things that we talk about in the session.
For me, I go to counseling. If you've seen any of my other videos, you know that. But for me, it's getting a perspective that's not emotionally attached to my issue, right?
Mm-hmm.
I can talk to my friends, I can talk to my family, I can lay awake at night and think all the other options. But when I go to counseling, when I see my therapist, I get perspective that's unrelated to my emotions. And I think that's the greatest key for me. My friends are great, but they're emotionally attached. They want what's best for me. They want me to feel better instantly. My therapist can see it from a perspective from the outside and say, well, that's great, except, and we outline it and we discuss it and we come up with a plan that's best for me and I feel comfortable with. Because even if my therapist says one thing and I go, yeah, but that still doesn't work for me, we go to plan B, like, right? So
Yeah.
that's the point, is being able to have that discussion, going back to having that relationship. Yeah, so that's my point. Yeah.
Yeah, no, and I agree. Friends and family are great. I highly encourage having friends and family.
Yes.
Some family. And and generally speaking, they have your best interest in the front of their thinking. Um, and sometimes they're too careful about the things that they say, and sometimes they're not careful enough. But they're not coming at it from a professional perspective. There is emotion connected, and that relationship is a different type of relationship than you have
Yes.
with a therapist. You see your therapist for a period of time, problems resolve, and you go on and you live a prosperous life.
I like that.
With friends and family, you have them for a while, and
Well, I think also sometimes the family may be the problem.
yes.
So getting advice from them may not be getting you to the other side, right? So
Yeah, you're talking about hidden agendas,
well,
and things like that. Absolutely, or not so hidden
or
agendas,
or narrowed ideologies, right?
yeah.
Right? It's like, well, what if I did think out here? What if my solution is out here? No.
Mm-hmm.
So perspective.
Yeah, well, I know you so well. I know what you're thinking. I know what you're feeling, and it doesn't matter what you say or what you feel. I know because I've known you since you were a child, right? That's what a
That's
parent
right.
might say.
That's right.
Right? You've always been like this since you were 4.
Right.
And
But I don't want to be.
that's right.
That's the whole point. I've been trying to tell you. It's
That's
like,
why I'm going to see Dr. Zio.
yeah, that's right.
And maybe I'm this way because of our relationship. I don't know.
Right. That's right. Perspective. Right. I
Perspective.
love it. Okay. Just a moment. Let's see. So how would one know it may be time to seek out a therapist?
Well, I think if you're struggling, and you've been struggling for a while.
What does that look like, though? I mean, some of us live in the, it happens over time that we end up down here, that we don't notice that we ended up down here. So what does struggling look like?
Struggling looks like different things to different people, I think.
Okay.
I think that if you find that you're anxious about things, and no matter what you've tried to do on your own, you continue to be anxious, you're fearful. You feel like you're sad all the time, and you don't know why, and you try different things. You watch Three Stooges, if you know Three Stooges. You do all different things to try to pick yourself up and feel better, and it's just not working. If you're having conflict at work or with peers, or your friendships are starting to feel a little strained, and I don't know, you're feeling a little disconnected, and you
Okay.
despite your best efforts, maybe it's time to talk to somebody about it.
Okay. All right.
I think so many of us, we kind of tough it out, right? We're feeling down, but little orphan Annie says the sun will come out tomorrow, and sometimes it does come out, and we're still feeling sad, and we can't figure out what that's about.
Right.
And so it can be helpful to talk to somebody, a trained professional, about why am I feeling the way that I,
Right.
and what can I do to get out of this rut or this hole that I feel like I'm in. Why is it that I get anxious every time I go into Giant? It's this. I know the price of eggs are up, but I don't think
That's nothing to cry over.
It's nothing to cry over. Maybe I'll switch from eggs, but to be able, and I don't want to make light of it.
Yes,
the idea is that
absolutely.
sometimes we get anxious about things, and we don't know why, and we try to kind of suck it up and soldier on, but it can be very hard.
Okay.
And some things in life are hard, but not everything has to be
And
hard.
it shouldn't be every day, and it shouldn't be all day, and it shouldn't keep you awake at night, and it shouldn't
impact your your job. It shouldn't impact
Right.
your relationships.
Okay.
If you're a parent, it shouldn't impact your parenting. And look, it does on occasion, but if it's doing it consistently and you're seeing
Right.
that it's really impacting the relationships around you, you probably need to get some help. Come and talk to somebody.
So what do we do about the people who are not willing to see that they need help? We see it. We're impacted by it. We are those peers and friends and family. How do we encourage someone to seek help?
Well, it's helpful if the person encouraging the person to seek help has gotten help themselves,
Okay.
right? Because sometimes, unfortunately, and that's why Mental Health Month is so important, because some of us were brought up to feel that we have to pick ourselves up by our own bootstraps, and we have to, that old expression, which is kind of sexist, man up, put your long trousers on, or whatever the expression is, and just toughen up. That's all. That stuff is not very helpful,
Right.
and I think that if you've and as a result, people are afraid to seek therapy because they're afraid there's something seriously wrong with them.
Right.
But you know what? There's what's wrong with most of us is we're human beings, and we struggle with all the same things, and sometimes it's just helpful to talk to another person. And if you have a friend or a family member who's sought help, professional help in the past, and they say to you, "Hey, you know what, Stacy, I think you've been struggling with this for a while. It might help you." I've seen a therapist myself.
Right.
That takes some of the, I'm going to use the word stigma. That takes some of the stigma off of it, because if Stacy's seen a therapist and she's doing really well, then maybe I can see a therapist and I can do really well too.
I've been seeing a therapist and I'm doing very well, like legitimately. So, which is why I brought Dr. Zio in, so he can explain the other side of it to everyone.
And I think it is important to, not be afraid to share with somebody who you're close to, who's struggling, that, hey, listen, I've gone to therapy.
Yes.
It could help you as well.
Yes. And it may not be the end all fix all.
Yeah.
Just like, every other health therapy that's out there, it's another thing to add. I mean, you may still need your primary doctor. They may be physical reasons, right? But right now, in that emotional crunch, to have a therapist, you got to put all the pieces together, right?
Yeah, you said something that's important about there might be other reasons, medical reasons, thyroid issues,
right?
Other, high blood pressure. There's so many different
Hormones.
Absolutely. There are physiological things that can impact our emotional functioning as well. So to be able to get a good medical workup is important, so that if there's something physiologically going on with you, you can get an intervention that way.
Get the whole picture.
Yeah, and if there's something that is situational, or that's generating negative emotion and struggle, talking to a psychologist about that can be helpful,
right,
as well. So I think, yes, most definitely, maybe you start with your medical professional, and if they refer you to a psychologist, take the referral,
right,
because it can be very helpful.
I refer out all the time in my field. This is beyond me, or I think it'll be better if I tag team with this professional or whatever. Same thing, right? You're just trying to cover from every angle and address the whole problem, the whole person.
Right. I want to say something else about therapy too. So if you go to your primary physician and you have heartburn, and so they give you some medication to use to deal with your heartburn, and you refuse to take it, what happens?
You still have heartburn.
You still have heartburn. And the same thing with therapy. If you go see a psychologist or a counselor and you're working on an issue, and there are suggestions that are made for in between sessions, if you don't follow the protocol,
Yeah.
you're still going to get the heartburn.
Right.
You're still gonna struggle, and sometimes it's difficult to realize that, if the difficulties that we have are relational. Sometimes it's difficult to come to a place where you understand that I can't change the other person.
Right.
All I can do is change. I'll use the word that you used. All I can do is change my own perspective, and make decisions about how I want to be in this relationship. Or, depending on the relationship, if I want to be in the relationship.
That's fair.
And, but you're not helpless in that. I mean, you need to be able to think things through and be willing to take action.
Right.
Or you're going to struggle with heartburn. You just are.
That gets uncomfortable after a while.
Oh.
Yeah. No, excellent scenario. So let's talk about, the big elephant in the country is insurance, right? So a lot of people, I run into it with my field. They can't afford it, and they say, well, if it's not covered under my insurance, then I can't go. And it's like, okay, well, what resources are there? And I know in our area here in Pennsylvania, in Quakertown, the area, that there are some resources, but the wait list is forever. It's like, so do you have recommendations for us?
The wait lists are forever. They're not really forever, but
It feels like it.
It feels like it.
Several months. And if you're in crisis, what does that,
Right. And, a lot of psychologists and counselors today are not taking insurance anyway.
Right.
A lot of psychologists and counselors, not so much psychiatrists, but as far as I know, I shouldn't say that, but right. Counselors and psychologists, a lot of them have a sliding scale for folks who don't have insurance or have really high deductibles and can't afford their deductible. I mean, it's going to cost something
right.
to see a professional. So we need to understand that. What's the cost of health?
Yes.
So, and it's easy to say, for me to sit here and say, what's the cost of health? But if it's a choice between feeding my family or going to therapy, I guess I'm going to struggle a little while, right?
Yes.
Because I have to feed my family. But having said that, there are other options. And one option is that there are different churches in the area have counseling centers as well.
Okay.
That offer therapy. A lot of them have fees attached, not all of them, but even those that have fees attached, sometimes there's a stipend that you can get from the church, so it doesn't cost you anything or cost you very little.
Okay.
I know there's some places in Philadelphia that are focused in the same way. They're kind of ministry based. They're not sectarian necessarily, but they're connected with a lot of different churches, and they have grants available. So I think those are a couple of options. But unfortunately, we live in America, and everything costs money. The one thing about people in behavioral health, though, or mental health psychologists and counselors, is that they're generally really good people who are very empathetic, very caring, very compassionate. And if they can work with you,
they're going to make
a way. They will. Some people will take payment plans. Not everybody, just to be clear, not everybody.
It doesn't hurt to ask.
But it doesn't hurt. It doesn't hurt to ask.
Okay.
So.
That's awesome. Okay. Whew. No excuses. There's no excuses. Okay. So let's see. I'm going through my notes. Wow, we've covered quite a bit. I think the one here is, and I hear this, people don't want to be labeled. They're afraid that if they go to a psychologist or someone, they're going to get labeled that they're ADD, or they are, bipolar, or they are, depressed, or guess what? You're probably depressed, or whatever. Labels, I think, really stem from diagnosis codes, right? If you're doing insurance and stuff. But we don't really need to be afraid of labels, do we? They're not really labels, they're diagnoses, and that gives us a treatment plan. Like, talk us through just a little bit about, I call them labels, but you know.
No, labels is a good word. I don't like labels.
Right.
From my perspective, labels are pretty much shorthand for professionals to talk about a grouping of symptoms.
Okay.
Low motivation, sadness, poor sleep, obsessive thoughts, depression.
Okay.
So we can it's really shorthand. But people aren't labels, they're human beings, and we all experience a lot of the same things at different times and with different intensities.
Right.
So I also am not a big fan of labels. Unfortunately, you need a diagnosis sometimes to get the help that you need. If you're using your insurance, providers aren't going to be paid by your insurance company unless they provide a diagnosis.
Okay.
Some clients want to hear a diagnosis. They want to know, well, what's wrong with me?
Right.
My response to that generally is, well, you're a human being. That's what's wrong with you. As human beings, we have a lot of different struggles in our lives. The question is, how are we going to manage those struggles? So, again, I'm not a big fan of labels, but unfortunately, they can be necessary. The other reason why I'm not really a big fan of labels is because sometimes people own their label.
Yes.
Like, I have to excuse your behavior because you have this label. Well, I don't know. I don't know that I necessarily need to excuse your behavior.
Right.
I might limit my exposure to your behavior. And so labels are, I can't speak for everybody in our profession.
Right.
I can't speak for everybody in the medical field, but for me, when it comes particularly to mental health diagnosis, I see the utility of labels, but I don't like them either.
Okay.
Because we experience depression. So what does that mean? We experience anxiety. So what does that mean? We have fluctuations in mood states throughout the day, throughout the week, throughout our lives. What does that mean? Are those diagnosable? So, I mean, if you were to say, well, what's wrong with me? I would say, well, look, you're a human being who's going through a stressful time, and this is the way you're managing your stress. And some of the strategies that you're using are helpful, and some of them aren't particularly helpful. So let's keep doing the helpful ones, and let's look at the ones that aren't particularly helpful.
Okay.
Now, again, sometimes diagnosis is important for getting paid, for understanding the symptoms that are going on around you, and sometimes it just makes people feel more comfortable to know.
Right. Well, because now they know, I tell people all the time, you are not alone.
That's right.
You are not the only one. You will not be the last one. And I think that gives them some comfort to know that, yes, I may have this label, but now I fit into a community of people who have the same experiences.
Yeah.
Right?
Who can understand.
Yes.
Yeah.
But it's the people, I think, like you were saying, who hide behind that. They want the excuse, but they're not willing to do the work.
Right.
Right? So, I come across those people too. They just want the magic pill. And
yeah, there is no magic pill.
I know.
There are a lot of pills, but none of them are really magic, know. And since you mentioned pills, sometimes medication can be helpful.
Mm-hmm.
Generally, I'm not a big fan of medication, but I've taken medication myself in the past for anxiety,
Mm-hmm.
and I'm a believer that medication can be helpful to get you over the hump.
Yes.
And to put you in a place emotionally where you can do the work of therapy.
Yes.
Now, some people do need medication for much longer. For example, people who have bipolar disorder, it can be, medication can stabilize you.
Yes.
you know, so that you don't have the really high highs and the very deep lows. You can, you know, have a more comfortable middle.
Yes.
And so that can be very helpful. Sometimes depression can be so deep and people become suicidal or maybe even rageful, and medication can help with that. But
even it all out.
even it all out.
Yes,
So
and
don't-
I've explained to people before I was on medication. You know, I would cry all the time for no apparent reason, and that's when I knew it was time to go see my physician, who then prescribed me a medication, and I sought out then a therapist so that I could handle both sides of it, both ends of it, because there must have been a reason that put me in that state to begin with. Right? So now I needed the stabilizer and the medication, and then I needed the therapist to help me deal with what was putting me in that state of mind to begin with.
Yeah, another thing to keep in mind with medication, again, I'm not a prescriber, but one of the things to keep in mind with medication is that there are a range of medications that treat similar symptoms. And so if you're prescribed a medication that's having some difficult side effects for you, you need to let your prescriber know as soon as you can, because there are other medications quite possibly that you could have that don't have those types of side effects. And so, I mean, if you get prescribed a medication and it doesn't seem to be working, or you're having difficulty sleeping, or you have some type of sexual dysfunction as a result of the medication or whatever it is, don't give up on medication. I mean, talk to your prescriber about it. Let them know what the side effects are, and they may be able to prescribe something else that your body will adjust to differently. While we're all human beings, our bodies do respond to things differently.
Right.
So some medications may work for one person and not for another. So keep that conversation going. And if you're in therapy with a psychologist or a counselor, talk to them about it too. And hopefully they'll make the same recommendation that if you're struggling with the medication, let's talk to the prescriber about it and see what's going on.
Okay. Is there anything that you would like to share that we haven't discussed?
No, just that I think therapy can be very important for most people. In fact, I keep going back to Freud because he's fallen out of favor over the last few decades. But, one of the things that he was a proponent of, he said that everybody could benefit from therapy and that it should be provided to everybody free of charge. Now, we live in America, and
nothing's free
so
here.
Nothing is free of charge. But I think it can be useful, as we're going through difficult times. And it doesn't have to be lifelong therapy. I've had people come and see me for one session to talk through things, and other people I've seen for much longer than that. But don't hesitate to seek somebody out. You don't have to struggle alone. There is help, and so I would recommend just reaching out. You don't have to feel the pain like you feel it if you're feeling pain.
Yes, thank you very much.
Okay, hope that's helpful.
It's very helpful. I appreciate your time today, and if we get any questions, I'll have to hit you up with those later. Okay?
Sounds good.
All right. Thank you so much.
Thank you. Take care.